And do.
Hello there.
Is it getting you? Hello?
Perfect.
Okay. Okay.
Okay.
Focus on wrong.
Okay.
I'm Lauren Cranfield, and my speech is over post-traumatic stress disorder. The National Institution of Mental Health estimated that post-traumatic stress disorder affects about 5.2 million adult Americans. It is estimated that a person's risk of developing post-traumatic stress disorder over the course of their life is about 8 and 10%. On average, 30% of soldiers who have been in a war zone develop post-traumatic stress disorder. Women are at a greater risk of post-traumatic stress disorder, while men are at a greater risk of developing post-traumatic stress disorder. Following military combat, traumatic stress disorder can take over someone's life, but there are ways to cope with this disorder. You may have a friend, a relative, or an acquaintance that has had a traumatic event and suffers from PTSD. My father has been in the Navy and had recently been given instruction to the Iraq police on administrative responsibilities and general police duties. He had to leave due to things that went on there and suffers from post-traumatic stress disorder. Preview of main points. Post-traumatic stress disorder is an emotional illness that may be a sensitive subject, but I will tell you how the symptoms, treatment, and how my friends and family can help. National Institute of Mental Health states that post-traumatic stress disorder is an anxiety disorder that can develop after exposure to a terrifying event and an ordeal in which great physical harm occurred or was threatened. Understanding the main information and symptoms of post-traumatic stress disorder will help lead you to a step closer to the right direction. The helpguide.org defines post-traumatic stress disorder as a disorder that can develop following a traumatic stress event that threatens your safety or makes you feel helpless. Traumatic events such as war, rape, natural disorders, car or plane crash, kidnapping, violent assault, sexual or physical abuse, medical procedures, especially in kids, natural disasters, car or plane crash, kidnapping, violent assault, sexual or physical abuse, medical procedures can cause post-traumatic stress disorder. Approximately 5.2 adult Americans suffer from PTSD. Symptoms of PTSD include re-experiencing the traumatic event, avoidance of emotional numbing, and increased arousal and becoming increasingly moody. Once you know the information and the symptoms of post-traumatic stress disorder, then you need to know how to treat it. The helpguide.org on the web provides information on how to locate assistance for PTSD, to find a therapist for PTSD, seek out psychological health professionals who concentrate in the development of trauma and PTSD. You can ask your doctor if he or she can provide a referral. However, he or she may not know therapists with experience treating trauma. Treatment includes trauma-focused cognitive behavioral therapy, family therapy, and medication. Now that you have the means necessary to get help, you still have to consider how friends and family can help. Friends and family need to be patient and understanding. Try to anticipate and prepare for PTSD triggers. Not take symptoms of PTSD seriously. Make sure to not pressure into talking and encourage not to drink. You have learned about post-traumatic stress disorder is and what the warning signs consist of, how to treat it, and how family and friends can be assisted. Finally, having the right people and catching the signs of PTSD can lead to a healthier life. My sources are www.cdc.gov, medicinenet.com, and wrongdiagnosis.com. That's it.
Yay!
I clicked stop like 3 times now.
Okay.
Alexa,
Yeah, it's not stopped though.
I was talking to Kevin today, so